Welcome everyone to our 9th annual Overrun Ovarian Cancer 5K. I'm Kelly Eckerman with KMBC TV and so proud to again be a sponsor of this important fundraiser. This is of course our first virtual event. We're so grateful to all of you for joining us in this fight against ovarian cancer. We know there's a lot going on in your lives right now and we're glad that you're still making this a priority even during a pandemic. While we were hoping to see everyone in person, we can't thank you enough for the support you've given us in this unprecedented year. Despite all the unusual circumstances, you have made 2020 another successful year in the fight. This year, we want to virtually salute all of the ovarian cancer survivors. You're our heroes, and we support you wherever you are. As you know, proceeds from the Overrun will benefit much-needed ovarian cancer research at the University of Kansas Cancer Center. This is through the Overrun Ovarian Cancer Fund. The proceeds also support patient advocacy in the Kansas City metro area by providing local hospitals with chemo comfort and care bags for newly diagnosed patients. Nearly 22,000 women will be diagnosed with ovarian cancer in 2020. 1 in 75 women will develop ovarian cancer in her lifetime. Now, because the signs and symptoms of ovarian cancer are subtle and there's no early detection test available, most women are diagnosed at an advanced stage. We're hoping not only to change that, but also to add and improve treatment options for these women because we've waited long enough. Ovarian cancer needs a stronger voice and you're helping us make that voice heard. We want to thank the nearly 60 virtual teams joining us this year. As always, thank you all for getting together and teaming up against ovarian cancer. Now, although the event will look a lot different this year, we remain fully committed to our fight against ovarian cancer, the push for better treatment options, an early detection test, and of course, ultimately a cure. We're grateful to our Overrun community for staying with us in this fight, especially during such uncertain times. Many things have changed in our world. Cancer has not. We believe in a cure.
Hi, I'm Brenda Shoup, gynecologic oncologist at Advent Health Shawnee Mission, and we're partnered with the Overrun Ovarian Cancer Foundation to help educate the public on the signs and symptoms of ovarian cancer and also hopefully help you communicate better with your primary care provider to identify the disease at the earliest stage possible. Some of the questions I get asked are, what are the signs and symptoms of ovarian cancer? And they can be very vague and common, which unfortunately makes it hard to diagnose early. They can be lower abdominal pain, sometimes abnormal bleeding, or change in bowel and bladder function, such as constipation, or all of a sudden having to get up in the middle of the night and go to the bathroom, which is unusual for you. If those symptoms were to persist for about 2 weeks or so and you notice that they're different, then that would be a reason for you to discuss them with your primary care provider or your gynecologic provider. People always also ask what is the risk factor for ovary cancer? And the most important risk factor is having a family history of ovarian cancer, such as first or secondary relatives with the diagnosis of ovarian cancer or fallopian tube cancer, or a personal history of breast cancer can elevate your risk as well. If you have a known BRCA mutation or a genetic predisposition to the development of breast and ovary cancer, that certainly elevates your risk. And in those patients, we can mitigate that risk significantly by prophylactic surgery and sometimes with medical management as well. How do you decrease your risk of ovarian cancer? Maintain a normal body weight, healthy lifestyle, don't smoke, and most importantly, continue to see your primary care provider or gynecologic provider on an annual basis. Discuss any of the symptoms that you might be experiencing and ask questions. See if they feel like further testing would be needed. And to make the diagnosis of ovarian cancer, that typically requires a biopsy or surgery, but sometimes we will preliminarily order ultrasound or blood tests such as the CA-125 to see if you're at elevated risk. In conclusion, the symptoms are vague, but if you keep open communication with your primary care provider, continue to see your provider on an annual basis, and know your family and medical history, that's the best way for you to try to decrease your risk and help identify it early and improve prognosis.
Although we are in very difficult times in dealing with a global pandemic, cancer is not retreating. By 2040, the global burden of cancer is expected to grow to 27.5 million new cases diagnosed each year and over 16 million cancer deaths simply due to the growth and aging of the population. More than 300,000 women are diagnosed annually with ovarian cancer in the world. In 2018, nearly 185,000 deaths occurred due to ovarian cancer, emphasizing the need to continue to understand the cause and develop potential cures for the disease. It has been a pleasure to get to collaborate with the founders and organizers of OVERRUN for the past 9 years. Each of these strong women have a personal story of how this disease has impacted their lives, and all have a passion to change the face of ovarian cancer through research. Funds raised by the OVERRUN continue to help support research at the University of Kansas Cancer Center. Since starting this cause and holding these events, OVERRUN has donated nearly $350,000 to ovarian cancer research to better understand the cause and potential cures of the disease. As all of the money donated has gone to fund young scientists who have passion to improve the outcomes for women diagnosed with this disease. With me this morning are two past recipients of an OVERRUN Ovarian Cancer Fellowship, Camille Trinidad and Ashley Tetlow, graduate students at the KU Medical Center. Both continue their research focused on better ways to detect and diagnose ovarian cancer. Ben Gibbs, an MD PhD student at the KU Medical Center, is the current OVERRUN Fellow and is working with a team of scientists both at the KU Lawrence and KU Medical Center campuses to develop new therapeutics to treat women with the deadliest forms of ovarian cancer. Due to the COVID-19 pandemic, he has provided a pre-recorded message which can be found on the OVERRUN website.
As a society, we have learned a lot about the importance of medical research since the beginning of 2020, and what can happen if we neglect it as a society. We lose about 600,000 Americans to cancer each year. Each of these people have a family and friends, have a career, and make an impact on society. If we have learned anything from 2020, it is that these premature deaths have impact that radiate far beyond their loved ones. Each individual death impacts everyone else. To limit this impact, we must continue to improve our current tools for diagnosing and treating cancer. Although the circumstances around COVID-19 pandemic have made research more difficult, we have persevered through it and have made progress towards finding better diagnostics and therapeutics that will improve the outcomes for many women diagnosed with ovarian cancer. Since joining Dr. Godwin's lab in 2019, I have been working on making a new therapeutic for women with ovarian cancer. We have identified a protein necessary for cell division. However, when we target this protein, another similar protein will take over. We have been working on targeting the second protein so that we can stop both simultaneously. Starting with over 250,000 drug-like compounds, we have used state-of-the-art technologies to identify two scaffolds that block the second protein. We are now modifying the scaffold in an attempt to make more drug-like properties. Although drug development is a long process, this is a significant progression towards having a new compound that can work safely and effectively in women diagnosed with ovarian cancer.
In closing, I'd like to thank each and every one of you for continuing to participate in this event. Although we are not all together this morning, your participation not only helps raise money to advance research in ovarian cancer, but most importantly raises awareness regarding these devastating diseases collectively known as ovarian cancer. Again, thank you for your support of our efforts locally and nationally to increase awareness and to develop new therapies for the brave women fighting this disease. Thank you.